Hello, my name is Dr. Andy Smith. I'm the Executive Medical Director here at the South Western Ambulance Service. I've also been a GP and continue to be a GP for the last 20 years. I'm talking to you today about how you can help us to get the very best care for your sick patient that needs transport to hospital. You will all know the strain that the NHS is under. We certainly see significant surges of demand, especially at times when GPs are doing their visits. And it's very important that we make the absolute best use of our emergency ambulance fleet. When you do request a transport to hospital, it will be the same ambulances that also have to cover the calls from the 999 members of the public with sick children and critically ill people in their family. What we're asking you to do is just to stop and think through your options for getting your patient to hospital. The first one we would ask you to consider is whether the patient can safely make their own way. This may include the use of friends and family, or even in fact the use of taxis. Often with the less severely sick patient, this means they will get to hospital significantly quicker than if they wait for us to attend. If that isn't an option, we'd ask you to consider the non-emergency patient transport service. This is a dedicated fleet of ambulances who are not also trying to cover the 999 workload. If your patient can safely wait over 4 hours to get to hospital without it significantly affecting their care, this is an entirely appropriate means of transport. If they need to get to hospital within 4 hours, but they're not in an immediately life-threatening situation, then we'd ask you to call on our dedicated healthcare professional line, and we will arrange transportation to your patient within 1 to 4 hours according to your wishes. And finally, and it goes without saying, if you're concerned your patient has an immediately life-threatening problem and is critically ill, and this would include unconscious patients, patients who are not breathing adequately, patients who are bleeding severely, patients who are having a possible heart attack or a stroke, or you consider may have severe sepsis, then it is entirely appropriate that you call us on 999 and we will respond accordingly.